This is a brief PowerPoint tutorial that includes test-taking strategies for taking nursing examinations. You may not be familiar with all of the concepts illustrated here. After your first nursing exam, this will become more clear. First, we look at the parts of a question. The question will consist of a case situation, question stem, and options. The case scenario provides the information about the patient or client and information you need to consider in answering the question. The question stem asks something specific about the case situation. The options are all of the available answers. Some tips on how to avoid reading into the question. First, read the question and every option thoroughly and carefully. Next, ask yourself, what is the question asking? Then, be alert to keywords. Next, eliminate the incorrect options. Finally, use all your nursing knowledge, test-taking skills, and strategies to answer the question. On nursing exams, there are 3 possible types of questions, sometimes 4. We're going to only look at 3 here. The first is a multiple choice question. These have 4 options and you must select one. Next is the multiple response, also known as the select all that apply type question. These will have several options and you must select all options that apply to the situation in the question. And then last is a prioritization or ordered response type question. Here you will be required to list in order of priority certain nursing interventions. Look for the keywords. Keywords focus your attention. Some examples include early or late, best, first, initial, immediately, most likely, and most appropriate. Now we look at the issue of the question. The issue of the question is the specific subject content about which the question is asking. Often on nursing exams, questions require some level of prioritization. Some guidelines or strategies to use to determine how to best address the question include: look at the ABCs, consider safety, consider Maslow's hierarchy of needs, remember the steps of the nursing process. Prioritization questions often have keywords of best, essential, first, highest priority, immediate, initial, most important, next, primary, or vital. One helpful strategy to be able to prioritize is looking at ABCs, airway, breathing, and circulation. When using ABCs, remember that airway is always the priority. Do not confuse this order sequence with the sequence used for resuscitation and CPR. That correct sequence is CAB, circulation, airway, and breathing. If the question isn't asking you to prioritize based on ABCs, next consider safety. Think about the outcomes of each answer. Is there a potential for risk? Can the patient be harmed? What is the safest action? If ABCs or safety do not help in determining the correct answer, then consider Maslow's hierarchy. Remember, physiological needs are the first priority. Then you would continue to move up Maslow's hierarchy in order to determine if that's the appropriate strategy to use on this question. And last, consider use of the nursing process. Use the steps of the nursing process in order to prioritize. The steps include assessment, analysis, planning, implementation, and evaluation. When trying to consider if assessment is necessary in order to make a determination, look for assessment keywords such as ascertain, assess, check, determine, find out, identify, monitor, observe, or obtain information. For analysis questions require critical thinking and determining the rationale for the therapeutic intervention that may be addressed in the question. Planning questions require prioritizing nursing diagnoses, determining goals and outcome criteria for goals of care, developing the plan of care, and communication and documenting the plan of care. Implementation. Remember, when looking at implementation as how to approach the question, that the only patient about whom you need to be concerned is the patient in the question that you are answering. Remember, this is your only assigned patient. Answer the question as if the situation were textbook and ideal, as if the nurse had all the time and resources needed and readily available at the patient's bedside. Evaluation questions focus on comparing actual outcomes of care with expected outcomes and focus on how the nurse should monitor or make judgments concerning a response to therapy or to a nursing action. If you've looked at the NCLEX test plan on the website, you've probably noticed that the categories are broken into subcategories, and here we're looking at the client needs safe and effective care environment. Content in these questions relates to the nursing role of coordinating and integrating cost-effective care, supervising and collaborating with multidisciplinary healthcare teams, and environmental safety. Be alert to safety needs addressed in a question, and remember the importance of hand washing, call lights or alarms, bed positioning, the appropriate use of side rails, and standard precautions. Under Client Needs, Physiological Integrity, we'll have a few slides on this. This addresses the nurse's role in promoting physical health and well-being in the patient by providing care and comfort, reducing client risk potential, and managing health alterations. Relates to the basic care and comfort, pharmacological and parenteral therapies, reducing risk of complications, and managing and providing care to clients with acute, chronic, or life-threatening conditions. Remember, the physiological needs are a priority and are addressed first. Use the ABCs, Maslow's hierarchy of needs, and the steps of the nursing process when selecting an option addressing physiological integrity. Client Needs, Psychological Integrity. These questions address the nurse role in providing care to support and promote emotional, mental, and social well-being of the patient. These relate to promoting clients' ability to cope, adapt, or problem solve in situations such as illness or stress events, and to providing care to patients with maladaptive behavior or acute or chronic mental illness. In this client needs category, you may be asked communication type questions that relate to how you would respond to a patient, a client's family member or significant other, or to other healthcare team members. Some other strategies include using guidelines to delegate and make assignments. When needing to make a decision about how you can delegate, generally, non-invasive interventions such as skin care, range of motion exercises, ambulation, grooming, and hygiene measures can be assigned to a nursing assistant. A licensed practical nurse can perform the task of a nursing assistant, and additionally, certain invasive tasks such as dressing changes, suctioning, urinary catheterization, and administering medications orally or by injections. The registered nurse can perform the task a licensed practical nurse can perform and is responsible for assessment, planning, and supervising care, initiating teaching, and administering medications intravenously. For pharmacology type questions, if you are familiar with the medication, use your nursing knowledge to answer the question. Remember that the question will identify the generic name of the medication. If the question identifies a medical diagnosis, try to make a relationship between the medication and the diagnosis. Try to remember the classification of the medication being addressed to assist in answering the question. Identifying the classification will assist in determining a medication action and side effects. Recognize common side effects associated with each medication classification, and then relate nursing interventions to each side effect. Learn medications that belong to a classification by commonalities in their medication names. Look at the medication name and use the medical terminology to assist in determining the medication action. If the question requires a medication calculation, talk yourself through each step to be sure the answer makes sense and recheck the calculation before answering the question, particularly if the answer seems like an unusual dosage. We've talked to you several times about the different types of questions you can expect on our nursing exams here. As we talked about in class, one type that you might see is comprehension style questions. Comprehension style questions require you to understand information. You must commit facts to memory as well as translate, interpret, and determine the implications of that information. You demonstrate understanding when you translate or paraphrase information, interpret or summarize information, or determine the implications, consequences, corollaries, or effects of information. Comprehension questions expect you not only to know, but also to understand the information being tested. After you understand the basic information, you can recognize the significance of data, which is an initial step in critical thinking. The other type of question we have told you to anticipate is an application type question. These demonstrate a higher level of understanding. They require the learner to show, solve, modify, change, use, or manipulate information. To answer application questions, you must apply concepts you have learned previously to concrete situations. The concepts may be theories, technical principles, rules of procedures, generalizations, or ideas that have to be applied in a presented scenario. Application questions test your ability to use information in a new situation. And last is the analysis type question. This requires you to interpret a variety of data, to recognize the commonalities, differences, and interrelationships among presented ideas. To answer an analysis question, you must identify, examine, dissect, evaluate, or investigate the organization, systematic arrangement, or structure of the information presented in the question. Analysis questions make the assumption that you know, understand, and can apply information. A few tips on how to avoid reading into the question. Identify the ingredients of the question. What is the case event? What is the question query? What are the options? Next, identify strategic words or phrases. Then, identify the subject of the question. Use your nursing knowledge and the process of elimination. And don't ask what if when considering the options. That can lead you down a rabbit trail and get you in trouble fast. Here are some strategies to use when you are between two options. Read the question again. Identify the case event from the query of the question. Look for the strategic words or phrases. Identify the subject of the question. Ask yourself, what is the question asking? Then read the options again. Make your final choice by focusing on what the question is asking, use your nursing knowledge, and implement any test-taking strategies you have learned. Multiple response questions or select all that apply are often very difficult for students. One technique that you can employ to try and increase your ability on these types of questions is to treat each option or answer as an individual true or false statement based on what the question is asking. So I have an example of one here for you. A nurse assesses a patient and concludes that the patient has a fluid volume deficit. Which assessments support this conclusion? Select all that apply. So here we have 5 potential choices to choose from. And what makes this different than a multiple choice question is that we know that it is going to have at least 2 correct answers, and often more than that. So thinking about what you know about fluid volume deficit or dehydration and what assessment techniques you would use, then you make your best choices by reading each of those as a true-false statement on how to assess for fluid volume deficit and what those assessment findings might look like that would indicate a fluid volume deficit. A is tinting of the skin. True or false? Well, if you will recall from your assessment lab, we will be checking for skin turgor. The reason we check for skin turgor is to determine the hydration status of a patient. Next, decreased pulse. True or false? If you recall from your vital signs skills lab, some alterations in pulse rate were discussed there. C, true or false? Sudden weight loss. D, increased blood pressure. True or false? And last, E, longitudinal furrows in the tongue. True or false? The correct responses are A, C, and E. B is incorrect because the opposite would be true. The pulse increases to compensate for hypovolemia. D is also incorrect and the opposite would be true. Blood pressure decreases because of the decreased intravascular fluid volume. This concludes this recording, and I hope you find some of these test-taking strategies, tips, and techniques to be helpful to you on your upcoming first nursing exam.